Hey everybody, Dr. Schultz for the Centeno-Schultz Clinic. Today we're going to be talking about stem cell treatment for foot pain. Thank you for taking the time to watch this video. The goals are to identify the 7 major causes of foot pain, to learn about the treatment options for foot pain, understand that there are different types of stem cells, and what factors may actually impact the specific stem cell treatment. And most importantly, why you should care about foot pain and different stem cell treatments. So let's get started. So there's 7 major causes of foot pain, the first of which is arthritis. Now, there are many different types of arthritis, and they include juvenile, psoriatic, rheumatoid. But the most common type of arthritis is osteoarthritis. And it's basically a wearing down, kind of a wear and tear type of arthritis that affects the cartilage in the foot. The second most common cause of foot pain is a bone spur, as depicted here in this x-ray. It's a bony overgrowth that occurs on different edges of bone. It can vary in size and in location. And there are many causes of bone spurs, but one that you need to be aware of is instability. So if you have some ankle instability, you can actually be developing a bone spur. Factors that impact or put you at risk for a bone spur include age, increased weight, and foot arthritis. The third cause is a tendon injury. Now, as you recall, a tendon is a thick piece of connective tissue that connects the muscle to the bone. It has a very important function, and as such, it can be a site of irritation or injury. The most common that everyone should know about is the Achilles tendon, is depicted here. Here's the foot, and it's this thick cord at the back of your foot that goes into your heel, just right above the cup on your tennis shoe. That thick cord is your Achilles. And man, when it becomes inflamed, it is a game stopper. It stops you right in your tracks. That's the third cause. The fourth cause is ligament injury problems. Now, a ligament is also a piece of connective tissue, but it connects bone to bone. It provides important stability for both the foot and the ankle, and it too is susceptible to injury. The most common injury is an ankle sprain, as depicted here, where you stepped wrong, you may have come off the curb, maybe you made a sharp cut on the soccer field, and you twist the ligaments on the outside of the ankle, otherwise known as an ankle sprain. The next cause of foot pain is the fascia. The fascia is basically a thin piece of connective tissue that surrounds and actually separates muscles and nerves. It's all throughout the body, and its function is to stabilize that structure and separate the enveloped structure from other ones. The most common is the fascia in the base of the foot, and it's rich in nerve fibers, which makes it incredibly sensitive and, when inflamed, painful. The most common is plantar fasciitis. It typically presents as heel pain at the base of the foot, most predominant right when you get up in the morning and you put pressure on that foot. It's like there's an electrical current. So plantar fasciitis is a very common cause of foot pain. The other causes can include nerves. Now, nerves provide important information all throughout the body. They're present in the foot, and they can become irritated, injured, or compressed. Unlike other parts of the body, the foot doesn't have a lot of cushioning. The nerves have got to navigate around bony surfaces, and they're susceptible to injury and/or compression. A common syndrome that you should know about is called tarsal tunnel, which is depicted here. It's basically where the tibial nerve, as it goes around the ankle, becomes compressed, and it can create significant pain. And then finally, the last cause of foot pain that you should know about is what's called referred pain. Pain that is from an area different than where the actual tissue trauma is occurring. The classic example is someone that's having a heart attack or myocardial infarction. They actually may have pain in the arm, and that person doesn't need to see an orthopedic surgeon or have an x-ray because of a fracture. They're actually having ischemia or tissue problems in the heart itself, but it's manifest out here in the arm. So too with foot pain, and some patients that come to our clinic actually have irritation and or injury to the nerve in the low back, and how it presents is it's pain and or numbness in the foot. So a very important cause of foot pain that you should be aware of. Now, what are the treatment options for foot pain in 2021? First and foremost, conservative therapy, when appropriate, should always be the first line treatment. There are many different treatment options in this category, which include rest, activity restriction, safe anti-inflammatory medications such as turmeric, fish oil, stay away from the Aleve and Motrin, chiropractic care, and stretching. For those patients that don't respond to conservative therapy, oftentimes their provider will refer them out for a steroid injection. That's right, a steroid injection, just as depicted here. Now, steroids are very effective anti-inflammatory agents, but they come at a cost. They have significant potential to injure the cartilage, the ligaments, and the tendons. So beware, while they are effective agents to decrease inflammation, at a significant cost. And the third treatment in 2021 for foot pain is oftentimes surgery. There are different types of surgeries depending upon the actual problem. It could be open versus putting a small camera in the foot itself, which is called arthroscopy. There are lots of complications that you need to be aware of, which include infection, failure, escalation in pain, nerve injury, tendon injury, ligament injury, and equally important, there's a terrible syndrome called complex regional pain syndrome, otherwise known as reflex sympathetic dystrophy, and it is a game changer. It will stop you in your tracks, and it's basically a terrible condition where there's injury to the nerve, and there are not a lot of great solutions to it. Most importantly, surgery is not like having your oil changed. It results in a permanent change in the mechanics of the foot, and if you don't like it, you can't get a refund. The mechanics are changed forever. So what are the stem cell treatment options for foot pain? First, you need to know that there are different types of stem cells. That's right, not all stem cells are the same, just like not all apples are the same. There are many different types of apples, from Gala to Granny Smith. So too with stem cells. The most common are bone marrow derived, which is what we use here at the Centeno-Schultz Clinic. Other ones are adipose derived. We use them as a fat graft. And don't be deceived. Many people are advertising for what's called birth tissue, quote, stem cells. There's high-level literature to support that, in fact, these types of products contain no stem cells. They may be marketed under Wharton's jelly, amniotic fluid, but don't be deceived. They contain no living stem cells. What are the important factors that may impact the specific type of stem cell treatment? Well, here they are. At the Centeno-Schultz Clinic, we are absolutely committed to getting the correct diagnosis, first and foremost. What was the major problem that causes your foot pain? Is it arthritis? Is it a bone spur? Is it a tendon problem, ligament injury, a fascial, referred, or nerve? It's so important that you get the correct diagnosis, because the correct diagnosis will dictate the treatment. So here's the first question. What type of tissue is injured? Is there joint instability? Is there a tendon injury? And is there weakness in the foot because there's compromised irritation of the low back nerve that provides information to the foot? All very, very important questions that need to be addressed before the treatment even starts. The advantages of using stem cell for foot pain are numerous. They include, it's a non-invasive procedure. There's little downtime. We identify the underlying problem and treat the problem as opposed to mask them. In using stem cells, you're using your own stem cells to promote healing and recovery. Why should you care about foot pain? It's really important that you understand this one. Foot pain is basically a warning signal. It's like that light on your car. You know, you've got the car packed up, you're ready to go for a weekend trip. Everything's there, the kids are in the back, and you're on the highway, and that red light, that alert comes on. It's so too with foot pain. It's telling you that you have a problem that is worthy of further investigation. And if you don't, you know what can happen with that car. It can seize up, you can break down, and you can be in the middle of nowhere. Also, too, with foot pain, if it's left untreated, that arthritis may progress. That tendon injury can, and more likely than not, will progress. And things typically get worse. And when they do become worse, your treatment options become limited. So it's best to treat the problems while they're small and the treatment options are easy. What's the next step if you or a loved one has ongoing pain? Give us a phone call. Go onto our website. Come on in to our office either in Broomfield or Lone Tree, or from the convenience of a beach or mountain home, or from a city home. Have a telemedicine evaluation where you'll actually meet a board certified fellowship trained physician that has your best interest at heart. They will review your history, they'll review imaging, and most importantly, give you an accurate diagnosis so you can get the very best treatment option. Act today so before the injury, the pain, and the suffering progresses. Thank you so much for spending time with me this morning. Foot pain is an important topic. If you found this helpful, give us a thumbs up. Share this video, and until next time, this is Dr. Schultz at the Centeno-Schultz Clinic. Have a good day.